Okay, so welcome everyone. I want to begin by acknowledging that we, the organizers for today's lecture, are on the stolen territories of the Woolstook-Wawi, the Passamaquoddy, and the Mi'kmaq. These lands are bound by the Peace and Friendship Treaties, first signed in 1795, and then onwards between the British Crown and the Indigenous peoples of the Wabanagi region. And as Woolstook Grand Council Chief Ron Tremblay reminds us, the treaties did not involve the Indigenous peoples of this region surrendering or ceding 1 inch of land or 1 inch of water. This winter, the Atlantic Human Rights Center, St. Thomas University's Department of Human Rights, St. Thomas University's Department of Journalism and Communications, the MB Media Co-op, and Raven, a media project based at the University of New Brunswick, are inviting the public to this human rights and media lecture series. So in this series, we will hear from scholars of the media and scholars of the law, concerned about the media makers, grassroots activists, on how our media landscape is changing. So these speakers will tell us what they're doing to make our media landscape a more safe, just, equal space. So before introducing our speaker, I do want to give a special shout out to my human rights and media class who are here tonight and ready to ask some great questions, I'm sure. As well as I'd like to thank the folks who provided great assistance with the lecture series. So first to Aditya Rao, who serves on both the boards of the MB Media Co-op and the Atlantic Human Rights Center, two of the hosts for tonight, and who will also be delivering a lecture in this series on hate speech and the debates being had over Section 13 of the Canadian Human Rights Act. I also want to thank Shannon Brooke Murphy with the Atlantic Human Rights Center, Amanda DiPaolo, the chair of the Department of Human Rights at St. Thomas University, Jamie Gillies, the chair of the Department of Journalism and Communications at St. Thomas University, Susan O'Donnell with Raven, and also Ashlyn Albright at St. Thomas University Communications for making the series happen and for promoting it. So before turning to our speaker tonight, I also want to quickly announce that the next speaker in our series is Dr. Elizabeth Dubois, an associate professor of communications at the University of Ottawa. She will be speaking about political bots and helping us understand communication strategies that use automation and artificial intelligence. And that's on Tuesday, February 1st, at the same time at 5:30 p.m. Atlantic time, and here on Zoom, and you can use the same Zoom link that you're using tonight. So you can find out more about the series by visiting the MB Media Co-op website or Facebook page, or by visiting St. Thomas University's events webpage. Okay, so our speaker tonight, the first speaker kicking off the series is Nora Loreto on her new book, Spin Doctors, How Media and Politicians Misdiagnosed the COVID Pandemic. So Nora is an activist based in Quebec City. She's the author of 2 other books, Take Back the Fight, Organizing Feminism in the Digital Age, also published by Fernwood, a great publisher of books from that are critical, important books. And she's also the author of From Demonized to Organized, Building the New Union Movement. Nora is the editor of the Canadian Association of Labor Media, CALM. She's a writer, an activist, a podcaster, a facilitator. She presents regularly on media relations, writing, editing, social media, and online security and privacy. She probably could deliver many different talks in this lecture series, but tonight she is talking about her book. She writes regularly for different magazines and newspapers and online outlets. She provides commentary like to Canaland. She speaks about social movement organizing and activism, the far right, provides critical commentary on that. She's the co-host of the podcast Sandy and Nora Talk Politics, with Sandy Hudson, who is a co-founder of Black Lives Matter Toronto. And also she's involved in her local, in her home community in different solidarity and anti-Islamophobia movements. And she's also known for her spicy political tweets that have caused quite a stir in a good way. So tonight she will be speaking about her new book, Spin Doctors, which has received many positive reviews. And I've noted that it has made some bestseller lists. And I was so happy when I saw the book over the Christmas break in a tiny bookstore in my hometown of Miramichi. So Nora's book, draws our attention to the damage that can be done by a media that is uncritical and that perpetuates the status quo, the harmful status quo, during a time of crisis. So it's my pleasure to turn it over to Nora.
Thank you. Wow, that's an amazing introduction. And it is possible that you'll hear my phone ring because part of the movements, one of the movements that I'm involved with, we're getting to like our most hectic and chaotic time of the year. And so if that happens, I won't take the call. How about that? I'll just be off for an hour and a bit with you all instead of trying to manage whatever's going on here. Thank you so much for the invitation and especially to give me the opportunity to talk about such a massive issue. And I'm obviously biased because I've been doing nothing but paying attention to how journalists have covered COVID. But I think that this is the biggest story because it has its fingers in every aspect of the pandemic. Everything that was justified, every public health measure, every measure that was undone, every moment where people were told that they could be unmasked or they were told that they could let their guard down. All of these had direct impacts on public health, on individual health. And we know that there's direct connections between the way that journalists talked about the pandemic and are still talking about the pandemic and the way in which we have constructed the notion of who's at risk and who is less or not at risk. When taking on a topic like this, it's very hard to know where to start. That's not true. I totally know where I'm going to start. I think that the most important place to start is the end of February 2020, February 26th, 2020. I know where I was because I wrote about it in my book. I don't know if you all know where you were, February 26th, 2020. We're just about to enter March. I see some eyes going up going, where was I? I was in the United States going between airports. So I say foolishly because that was like very high risk. And I just managed to walk in between the COVID that was going on everywhere, but we didn't know at the time that it was far more prevalent than it was. A memo gets sent out by a joint memo from the WHO and China, and it gives a summary of everything that is known thanks to the Chinese experience. And in the memo, it covers all of society and what they think this illness is doing and how they think this illness is traveling. And by this time in Wuhan, things are calming down. And in Italy, things are exploding. They're really like getting to be very, very, very bad. And so most Canadians are watching China, we're watching Italy, and we're going, yeah, not knowing that watching the US was probably where we should have had our eyes, but fine, whatever. And so this memo comes out and it says, and it's just a small part of it, that it's very clear that COVID spreads within residential settings very fast, and it's very dangerous. And so this has implications for prisons and for long-term care and other kinds of residential facilities. And so this is sent out to the world as like, hey, FYI. And where were Canadian media at that moment? Well, in a lot of cases, they were freaking out about China, about how this was an illness that was being hidden, that China wasn't being honest with the world, that we need to be extra vigilant towards people returning to Canada from China. And there's this chaos that starts to erupt where we actually are far more concerned about China and Chinese people than this virus and what China is teaching us and telling us in this moment. The cover of Maclean's magazine that comes out a couple of days later is like a gas mask and says something like China, the virus, it's going to kill us or whatever. And there's this really hilarious, in retrospect, not at all hilarious, also in retrospect line, that the authors of the Maclean's feature write that there's this press conference held at a hospital in Toronto talking about what we know about the virus and how they're managing it. And this is one of the pieces of evidence for why Canada has been ranked the second best country in the world for preparing for pandemics. I mean, I'm reading this in, I don't know, November 2020, and I'm just like, what the hell? Oh my God. Oh, well, we were lying to ourselves, right? And I don't doubt that the journalists themselves were writing into this story, oh, thank God, we're the second best country prepared for this pandemic. I'm adding that into my story, and I'm feeling super good about it because I also don't want to get this illness. You look at the coverage in Canada, so you've got this whole demonizing China, and I'm looking like, so where is our Canadian journalists talking about long-term care, right? Where do we hear about long-term care? Because we now know it's public information that this is going to be a problem. Anyone that has a sliver of experience with the long-term care sector knows that it's a tinderbox. And so I'm looking around in retrospect, seeing what was being said. At the end of February, there's a press conference done in Nova Scotia where the premier of the province says, we have a very old population, right? Atlantic Canada, Quebec, very old population. This virus is going to hurt us the most because of our old population. And therefore, we're taking it seriously. And I'm like, almost, you're almost there. Okay, so where are you taking it seriously? No mention of long-term care, none. Finally, a couple of days later, news comes out that there's this massive outbreak in Washington state. It has direct connections to an outbreak that happens in the Lynn Valley Care community out in Vancouver, and all of a sudden long-term care becomes part of the story. And this is such an amazing example of politicians refusing to talk about the issues they know about being problematic, and journalists going along with the flow, just saying, you know what, I'm not an epidemiologist, I have no idea. And we start this construction of the narrative that flows from primarily doctors and all of their privileges and all of their blind spots and all of their diagnoses and being able to tell you what's going on, but not being able to necessarily tell you about, like, you know, the sociology of it. My God, right? Like, never the two shall meet. And this sets the tone for coverage in Canada for the rest of the pandemic. Now, I have written a lot about long-term care. And before this pandemic, my knowledge about long-term care was not very deep. I'd written about Elizabeth Wetlaufer, the serial killer in Southwestern Ontario, partly because I care about these issues, but also as I found out while writing about her in one case, that my grandmother was living in the facility where she murdered her last victim 2 months or 3 months before that happened. And so it's like a family community thing. It's a farming family in Southern Ontario. And, but aside from that, I had no real connection with this sector. And you start to realize, oh, that all of the issues that all of the activists in every corner of this country have been talking about, from underfunding within the healthcare system to the privatization of so much of healthcare, including long-term care, and the profit-driven models that exist in every part of this country. And then even where they don't exist, there's the profit-driven logic is still driving the way that we deliver long-term care. Quebec is a really good example of that, where it's still overwhelmingly public, but had the highest deaths. Everything from racism and disability, and the way that the journalists didn't even have disability on their lens at all until they were talking about how government documents weren't being put out in accessible formats. Or there was this wave of articles about the interpreters became visible at press conferences. And so it was like, who are these interpreters? How do they do their work? This is so interesting. But never talking about how what would happen, and what we knew would happen, was this is a pandemic that absolutely viciously targeted disabled people first, elderly people second, racialized people second, third. Obviously, these are Venn diagrams, right? Poor people, Indigenous people. And then never in any of the responses in any part of this country considered these as being the way to then manage the pandemic, to then give disabled people resources and money and PPE and access to spaces that they can control their airflow, or, you know, air filtration systems or whatever. None of that. It sets up the narrative in March 2020, and we never exit these narratives. These narratives are never changed. They're never upended. Every single time there's a little bit of a story that focuses on, oh, this is what life is like in long-term care. This is what life is like in long-term care if you're young. This is what living within an apartment building might look like during a pandemic. There was one kind of these stories every couple of weeks in some part in Canada. But by and large, what we were given was stenography from the journalist corps, repeating the lines from the state, and oftentimes repeating the lines, including the errors, including the unknowns, including diving into issues that journalists actually didn't have any kind of capacity to deal with themselves, and just say to average people, you know what, this is what's being said. So good luck. So I cover all of this in Spin Doctors. And as you can imagine, it was very, very interesting and difficult to write a book about the pandemic as we were living through the pandemic. Although, as I found out, it was pretty much the only way that I probably could have written this book. Looking back, I forgot how much I had forgotten. Because the way that it's like we live in this amazing moment where there's no history. And every time there's a new variant, we are reliving a story as if we haven't lived it before, right? And it's like, wait a minute, I have experience with this. Like I have already managed my life in some way. I have experience with the virus. Oh, no, but Alpha is worse. Alpha is worse. And you're like, whoa, okay, I'm going to be now more afraid than I was for OG COVID. Okay. Now you're good with Alpha. And it's like, oh no, P2, it's way worse. You're like, P2, what the hell is that? Okay. Delta, oh my God, this is so bad, right? Okay. Omicron, it's milder. Oh, thank God. But it's worse. Oh my God, right? And so we're constantly kept in this state of like total panic all the time without giving the tools to, one, protect ourselves, which is actually what we need, and two, without giving us like the idea of what actually do we mean when we say something is serious? What actually do we mean when we say something is mild? What actually are we saying when we're saying this person had 2 comorbidities, this person was healthy and died from COVID, right? As many of you, I'm sure, have seen and engaged in conversations about how ableism has worked its way throughout this entire pandemic. One of the great examples of this kind of coverage that I write about is an outbreak at a place called Roberto Place in Barrie, Ontario. So it's owned by the for-profit private company Jarlette Health Services. Jarlette operates only in Ontario, or pretty much only in Ontario. And at this time last year, all across Canada, infections were like on fire, right? We just finished the holiday season, and none of us were vaccinated, and you have these massive outbreaks. And so at the time, you've got Jarlette, or you've got Roberto Place in Barrie, but then you also had 2 other facilities in the Greater Toronto Area, which had just massive outbreaks. 81 people dying at Tender Care, 70 people dying at Orchard Villa in Oshawa, Tender Cares in Scarborough. And it's happening, the Tender Care outbreak's happening at the same time as the Roberto Place outbreak. But public health, and this is then broadcast all across Canada. I mean, and this was on the Current, and I just couldn't believe the message, the way that it was being constructed, was this is Alpha. This is the Alpha variant. There was someone that went on holidays. You know, they should have done that to the UK, and they came back with the Alpha variant. And they met with someone who worked in one of these facilities, and because of her, the worker, now 60 people have died. I mean, it goes up from there. I think the final death toll is 71 or something. So it was very, very serious. And this is the message. This is the Alpha variant. It gets broadcast all across Canada in this way. Alpha variant is just so transmissible. It's killing people faster than we could have ever imagined. And even though we're almost a year into this pandemic, we have a new pandemic on our hands. So as this is the line coming up from public health, and it's being repeated by politicians, and it's being repeated by journalists, the Ministry of Long-Term Care does an inspection. Now, we also found out that Ontario's Ministry of Long-Term Care stopped all proactive inspections in 2020. So these are a reactive inspection as a result of a critical incident. And they find that Roberto Place is still keeping people together who are COVID negative and COVID positive. They're still allowing people who have COVID to go into the dining hall, all over other people's rooms. There was no controls to make sure that people were separated. And this comes out and it gets a little bit of media coverage, but very, very little. And so you have this massive outbreak literally caused by the exact same thing that had been causing outbreaks in places all across Canada for almost a year. And journalists were still buying the line from public health that, oh no, this is a variant issue. This just couldn't have been prevented. It remixed the entire story into something that is I'm thinking in French here, that was fatalistic. Like we can't do anything to change what happened. It was a given, right? What do you expect? Rather than saying, oh, actually, population, this is what's happening. We have these facilities where people are sharing bedrooms and they are dying, as we saw in facilities in New Brunswick, as we saw the Northwood in Nova Scotia was, of course, the biggest outbreak in Atlantic Canada of that kind. And it was replicated all across Canada the mass deaths have thankfully ended. Even with Omicron, we are not seeing the kinds of mass death in long-term care that we have seen before it. So that's very, very good news, even if death rates are rising, which is very bad news. And so I guess at the end of all of this, like we look at this and say, like, how did this happen? Why is there no government opposition? Why are journalists being so complicit in how they're covering this pandemic? Who are they serving? And what is the point of all of this? And that, I think, obviously is something that we need to discuss because it's multifaceted and there's lots of reasons for that. But I think, we must be very clear. Everything about the pandemic response in every single province, regardless of the political stripe of the leadership in the province or the territory, was to protect the status quo. And in so doing, it was to protect everything operating as normal and hiding that operation from the average person who might not be directly connected to that operation. So forestry continues, mining continues, construction continues. In New Brunswick, you have this like surge in real estate and people are getting evicted because rents are going through the roof. All is normal. This is normal. People are making as much money as possible. And we're saying, wait, like, how come we're not stopping this virus? How come I'm doing everything I can? I'm washing my hands till they're raw. I'm wearing my mask. I'm wearing 2 masks. I'm wearing the best mask. Now I'm wearing 2 of the best masks. What is happening? And it's all because we've been told that stopping the pandemic has been in our hands. And we have never gotten out of that logic to understand that clusters of cases happen in communities. And if we're in one of those communities or we're outside of one of those communities is the biggest determinant of whether or not we're going to get COVID. There was amazing journalism done in the United States that showed that communities that had meatpacking facilities in them were far more likely to have very large COVID clusters than communities that don't have meatpacking facilities. And that study was done adjusted for race, adjusted for income, adjusted for location. It was just because these were centers where workers are in close contact with each other all day and with very little safety measures. And they live in precarious housing and they live in precarious transportation where they're also going to and from work together often. One of the victims that died was a bus driver for Cargill in Guelph, Ontario. So his job was driving workers to and from the plant, and he gets COVID while driving workers to and from work, and he dies. There is no coverage of these large-scale industrial workplaces, even though it's where COVID spread the most, and it's where people were put most at risk, with the exception of shared accommodation like residential care facilities, shelters, and another giant location that has not at all gotten any media coverage, which is apartment buildings, which I'm hoping to write about soon. But I read a little bit about it in Spin Doctors, but it's just a whole other place that we know that they're the most, Public Health Agency of Canada says apartment buildings are the highest, the characteristic most shared among people who have COVID, which is so fascinating. And yet everybody who lives in an apartment has been given nothing to help them through this pandemic and is told to sit in their apartment to avoid getting the virus. And so, I'm sure you all know someone that got COVID somewhere and has no idea where they got it because they haven't left home, right? Well, I'll ask them if they live in a condo or an apartment building. And so when everything in this pandemic was oriented towards protecting the status quo, there had to be an intentional and mass effort to ensure that we understand this pandemic as an individual situation, that my level of risk is the exact same as your level of risk, that people who got COVID may have just been unlucky, may have just not done enough to stay safe, and that everything gets placed on us, on the blame, rather than seeing these as structural issues within our communities. And that's been the biggest way in which it's that government has managed to control this pandemic in the way that they want to control it. The result, of course, is that people are highly anxious, that everyone can feel that something's not right, but they don't know how to articulate that. And that there's this massive like hopelessness, because how many of us would have been like certain that in a moment of a pandemic that every single government in this country would have been like, let it rip, allow people to just do what they can to not get COVID, but under no circumstances are we going to stop the food production, the forestry, the oil production that is the bedrock of our country. So I'm going to pause there because I really want to make sure that we have the opportunity to talk back and forth a little bit more than me just kind of unloading on you, though I'm also very happy to continue to unload. So I will just pause so that there's like not too much awkwardness, that you can ask a question if you have one, although I know Tracy's going to moderate that, but I will continue if there's no questions or comments.
Yeah, so if somebody wants to raise their hand or write something in the chat, yeah, you can do so right now. I know that you did say a few things that I think should raise discussion. Not sure if anybody wants to jump in.
Well, and I wanted to kind of give like the thing about the way that I wrote Spin Doctors, and the thing about the way that we have to understand our pandemic, is it touched every single aspect of society. And so I also want to make sure that everybody can feel like you can ask literally anything, because I have probably come across it. And so I see here from Aaron, the first question, or Aaron or Jeff, why do you think the huge anti-vax, anti-lockdown protests don't adopt your critical analysis, but instead take these wacky positions? Okay, that's like the $1 million question, right? How did the left fail to capture that population who's looking for answers, and who, like, in seeing, like, you know, Marx or, you know, Alex Jones, you go to Alex Jones rather than Marx. And of course, I mean, I'm sure you all have people in your lives that you've seen this happen to. I do as well. And it's really sad. And then, of course, then there's the folks who are left-wing who went anti-vax. I mean, thankfully, I know very few of those, but I do know some of them. And even my airtight argument, well, then go to Cuba to get the vaccine. Like, Cuba's great. They don't buy into global imperialism. They're not in on this global conspiracy. Just go to Cuba. And it's like, no. It's like, okay, so there's a limit to the logic, unfortunately. I think that like one of the sad realities of the left in general throughout the 2000s and the 2010s, and where are we now, the 2020s, although I won't count this decade yet because I mean we're still in like 2010 logic, is that the left is collapsed. I mean, there is no left, right? There are, I mean, all of you, I believe, would probably say like, I'm on the left and I do left-wing things, and I've been, hell, I still have a subscription to Socialist Worker, right? It's like, okay, like I know we sometimes have these things for nostalgia's sake. And I mean, I could probably like hold up one right now. But there is no left, right? There is no left, because in the post 9/11 period, the left has never regrouped in any kind of significant way, because for a whole bunch of reasons. And the reasons are not like our fault always. I mean, they're like maybe 10% our fault, but like 90% not our fault. And so when you have a labor movement that is oriented to making sure workers work at all costs, like, you know, we'll deal with the issues, but you guys have to keep coming into work, and very, very shy. I mean, of course, there was amazing labor action in your neck of the woods, and there has been some amazing labor action in different parts across Canada, but there's been nothing to consolidate people together, because a lot of the major players are so in such a broken state. And so the NDP completely failed to do anything interesting. In fact, it was actually acting as if they were a conservative government, and we're seeing that in British Columbia. That has impacts all across Canada for anybody who's trying to get other people to vote for the NDP. And we just didn't, there was just no movement organizing. Like the only movement organizing that happened within 2020, which was significant, was Black Lives Matter. And that was amazing. And it captured, I mean, the protests that happened in June 2020 all across Canada had never, like, you had BLM rallies happening in parts of this country that had never had a rally, let alone a rally for racial justice, let alone a rally for Black lives, right? So it's not that people aren't ready for this or trying to get involved in this. We have not figured out how to rebuild ourselves in a neoliberal age when so many of the tools that we used in the past just aren't possible anymore. Like there is no state funding for the stuff that we're doing. Solidarity has to look differently, and social media really, I think, on the balance of things, is a poison for social movement organizing. I mean, it offers some benefits for sure, but on the balance, I think that we put way too much stock in social media organizing, and we forget that it's, I mean, for-profit platforms that exploit us and that profit off of us. And sometimes, like, maybe the best friend that we made online is a cop. We don't know. It's hard to say, right? And I'll try to keep talking a little bit more of that too, because I think that could be a talk in and of itself. And I see that there's hands raised. I'm going to answer the next question in the chat, and then maybe we can go to some of the hands. And then can I comment on antibody testing? I'll actually be very quick on this. Antibody testing would have been very interesting before vaccines, right? If one of the story, I mean, because right now it would be very difficult to tell if you've had a vaccine, like if you've also had COVID, but there were some serotology, there was some serotology research done in some parts of Canada. And it definitely showed that there was higher rates of COVID than we know, just like the wastewater testing, which is also very interesting, right? These measures to see that, oh, actually COVID has traveled quite a lot. And thanks to that research in Ontario, I was part of a research paper that estimated Canada's true death rate as a ratio to deaths to infections, and then using many other measures, not just that. And our estimate was that by June 2021, almost double the number of Canadians had died from COVID than had been officially announced. And so I think that that's the real, like, you know, there's two stories there. One is what is the true toll of this pandemic? And we will not know that true toll until it plays itself out in all of our lives and across society and across the economy. But the other part of this pandemic is just that Canada's data regime is pathetic, that provinces don't actually count deaths very well. And New Brunswick is such a good example of this. Early in the pandemic, when someone died from COVID and the province was like, he died with COVID. And the family was like, no, he died from COVID. What the hell are you talking about? And they went to CBC, and the CBC is like, oh, what's going on here? And then the province is like, you know what? You're so right. He died from COVID, right? So going to journalists was how we were going to get a better count of COVID related deaths than actually just counting them properly. In Canada, of all of the deaths of people aged 80 and over, Quebec, it was the highest, assuming that those deaths were related to COVID, and they counted 96% of all excess deaths of people aged 80 and over. So those deaths that you would not expect to have happened, they attributed to COVID. In British Columbia, the same measure, they attributed 0 of those deaths to COVID. So we really have such a bad data regime that even antibody testing and the data that we would get from that, I mean, we're starting from less than 0 in terms of what we know. And it's really too bad that we didn't do more research in the early days, because we would have had some very interesting benchmarks to kind of show us where we are in this pandemic that we just do not have. So I will go, the first hand I see that is still up is Andre's hand. So go ahead.
Hi, can you hear me?
Mm-hmm.
Hi, Andre from St. John, New Brunswick. Big fan, listen to your podcast, long-time listener. Anyways, love your focus on New Brunswick. I'm a New Brunswicker. I put in my name just so everybody would know. I don't know. I haven't read your book yet. I am going to pick it up. That's a promise.
Awesome.
I just noticed you're focusing a lot on New Brunswick. Is New Brunswick a microcosm for the rest of the country? We've got a weak to no NDP. We've got a Tory MP. I mean, if you want to go on the political spectrum where they lie. Anyways, austerity to healthcare has left us completely unprepared. Here, probably more than, I don't know what it's like in other provinces. Again, bigger populations, but comparatively, I don't know what our patient to bed rate is. Beyond that, we've got the French-English divide, which is always the problem. This has led to the uprising of fringe parties like the People's Alliance here in New Brunswick. We've got labor action, massive labor action from QP. I'm sure you've been following it, which is, we can say it's a success. I don't know. Is it enough of a success? Probably not. Effects of the lumber tariffs on our province are huge. And that is all wrapped up even more in the energy crisis, the Irvings, the oligopoly, and the monopoly that they have over our resources. And they're not even our resources. This is unceded land. Like, just to further that, I don't know if there's a land acknowledgement. I was coming in late, but anyways, here's to you. Here's to everybody out there. Solidarity across the country.
Yeah, I mean, it's yes, I think that the benefit of a province like New Brunswick is that it is smaller. So like, imagine multiplying New Brunswick by like 15, and that's what Ontario activists are dealing with, right? It sucks. It's like when I moved to Quebec, I was like, oh my God, Ontario has 15 major cities and we have like 4. Like, it never really occurred to me because I grew up in Southern Ontario. But yeah, having a smaller location is really amazing because it means that that organizing looks a lot more grassroots. And I think that that community approach is the only way we're going to fix literally anything. And it also means that you have a better network of like the informal network of figuring out what is going on. And so I did notice there was a couple of deaths that happened in the fall, I think, in New Brunswick, where it took me 2 minutes to figure out who had died, because on Facebook, people were talking about it and they were giving condolences and this kind of thing. And that was really helpful. Whereas, I mean, in Ontario, it just gets swept into a freaking nothing. Like, you just can't find anything. And so I think from like activists really should be doing as much data crunching as possible, clandestine data crunching as possible, doing as much of that grassroots organizing and checking on people, because like the biggest thing that we're going to be facing is the trauma of in the aftermath of this. And I'm sure you all are feeling that like people are not doing okay right now. And it's in those moments that being in a smaller community, I think, is really, really beneficial, because I mean, it's also more difficult because then the tensions get really high and it's like your neighbor and you have to see that guy every day at the grocery store. But, it's a good reminder that the only way we're going to help to heal this collective trauma is by doing that kind of work together. I keep saying that with the anti-vaxxers, like, unless we're going door to door with them to try and talk with them and see if they're actually formally declining the vaccine, we can't say that people are actually anti-vax. And then once we do that, and then there are people who are anti-vax, it's like, okay, now we have a group of people who are formally like, I am out. And you're like, okay, interesting. That changes the kind of conversation that we're gonna have. But yeah, I think the other side of it, of being very small, is with all those forces that are very common within Canada, is that you can see them replicated everywhere. You can see them replicated on Vancouver Island, and you can see them replicated in southern Saskatchewan, and you can see them replicated, like, the differences are not that big either, which is, I always find very, very interesting about this country. So Jessica asked the next question, and it's like, I'm not surprised by this question because we are in conversations about this. So the media coverage on kids returning to school or not returning to school has been very confusing. Okay, so here are my thoughts. This is a pandemic that has killed older people at a rate that is just unthinkable. And if it was in reverse, that it was killing children at a rate that was unthinkable, I think that we'd be approaching it differently. Right? There's ableism in this because it's older people who are disabled, right? There's a reason why retirement residences, people have more autonomy, did not have as high death counts on average as long-term care and assisted living facilities. And I think also we need to say to ourselves, rather than going, yeah, we don't know what the future holds, because of course we don't know what the future holds. Thank God that we're also not dealing with massive children death, because I think that would be like a whole other layer of really, really difficult, sad thing. I mean, people will remember, some people will remember the polio pandemic. So I remember that it's like, we're dealing with an ableist and an ageist pandemic. And the focus on older people, on disabled people, is so critical, which means children, but kind of disproportionately. It means, like, we cannot forget that today's numbers are going to be people who are mostly older of who's died. Okay, so having said that, where do children fit into this picture? I think that schools have been overblown in how much spread they cause in a community. And I don't think that we can even look at, do schools like circulate the virus or not? Schools are a community setting, and they will amplify what is happening in the community. And so if there's an outbreak in the community, it will appear in the schools. If there's not an outbreak in the community, it will not appear in the schools. And I think when we take the school out of the community, then it's like, well, of course, kids are together all day. They're eating without their masks on. They're all going to get COVID. Oh my God. The data does not exactly show that. But you can make the data say anything. So I try not to just rely on the data pieces. But the Canadians who have had the most COVID as a percentage of their population are Canadians aged 20 to 29 by a lot. The next most affected disproportionately to their makeup of the population are Canadians aged 30 to 39. And so who are they? Those are the workers who are frontline, who are low income, who are living in apartments, who have roommates, who can't control their living arrangements or whatever. When you look at children make up, I want to make sure I get at least kind of my numbers right here because it's all by memory, but children make up 16% of the population in Canada and 11% of the COVID infections. So I think that if we saw schools driving the pandemic, children would be overrepresented in how many cases they have. Of course, there's all the caveats of who's tested and are all the children tested if they're asymptomatic, but also children live with other people. So unlike adults who are asymptomatic, there's likely a case that if there's a case in the house, the whole family's getting tested rather than just that one case. So I do think that that's also very encouraging to remind ourselves that even in the measure of who's gotten COVID, it's not like children are not overrepresented. It's young workers, younger workers. And so what do schools give us? I mean, schools have to close if community spread is very, very high, which means that we have to look at schools in that community perspective and not blanket shut down schools. I mean, that doesn't make any sense. Ontario blanket shut down schools last spring, and there were schools shut down in neighborhoods and communities with literally no COVID. And they did that just because it was easier. It was more politically expedient for the province to do that. And then of course it's like, why? Like you just left kids home, you left parents like completely in the lurch and all this stuff. Schools also, because they're public institutions, you can do testing in a way that you cannot do testing in private settings. You can use schools as an early warning signal for, there's a cluster of cases. Where do their parents work? Right? What kind of relationship do these kids have? Did they get it in the classroom? Okay, so then what's wrong with the classroom? Or did they get it because their parents are all working in a meatpacking facility and there's a massive outbreak there, but the private corporation won't name it? And so we actually don't know that there's an outbreak there. We just know that there might be cases circulating. So schools are a really important location for that because it's a formal state-controlled location to find out about spread. And they're really important because at the end of the day, school closures really only benefit the parents that can stay home. The parents that can't stay home are going to have children that are put into even more precarious situations because they have to go somewhere. And so that means grandparents watching them or other family members watching them or going from one to the other to cobble together a week of care because they just can't be anywhere else. And so we're hearing, I think this is now me being very editorial, and you might disagree with me, but it does feel like it's by and large middle income and upper income white parents who are the most afraid to send their kids home because they're the most able to keep them home or send them to school. And they're the most like, oh my God, I could have kept them home and they got COVID. Unlike the parents were like, I mean, I got to work. So whether they get COVID there, whether they get COVID for my informal care arrangement, this all sucks. I hate this. And so I don't know if that's helpful, but you know, I was looking at like data on car accidents for kids, and it's like something like 160 teens to infants died in car accidents in 2019. And the number of kids 0 to 19-year-olds who died from COVID is 24 total. Okay, they're all a tragedy. But 18,000 Canadians aged 80 and older died as well. And so what I really don't like seeing is the obsession with schools at the expense of, okay, let's talk about manufacturing. Let's talk about where those 20 to 29-year-olds are all getting COVID. Let's talk about elder care, and let's talk about like actual solutions in long-term care, not just vaccinating our way out of this, because the fourth dose is not going to save people from more COVID. We know people are getting COVID with 3 doses. And I just think that schools are the place that politicians can get the most because they don't have to do anything. It freaks parents out. Parents are the ones that are paying for newspaper subscriptions. And so the newspapers love it. And then it becomes a cacophony. Like it just becomes this scary thing that, oh my God, I'm going to put my kid into harm's way because I'm sending them to school. And I say all of that recognizing that testing needs to be better, ventilation needs to be better, classes need to be smaller, teachers need paid sick days, kids need to have days off that aren't online school. Like that's okay too, if kids are just sent home a day at a time to have online school. And then something that I see here, and I don't know how widespread it is in all the cases, the kids who have, we've had daycares open for kids, for parents that have no other options. So daycares, but for school-aged children, those have operated without outbreaks. And my school has a special program for kids with complex disabilities, and those have not closed, and they also haven't had outbreaks. So there's ways to do it to make sure that kids are kept safe. And parents are desperate for that to happen, but politicians have never put for kids into the middle to make sure they're safe. They've been used as a political football, and I think it's really too bad. Okay, next question. What are my thoughts about GNB disguising the case counts, confusing data posts? So fully vaxxed, partially vaxxed. Yeah. So, okay, so this isn't just about New Brunswick. When I say that the data regime in Canada is bad, it's like a disaster. Okay, like Saskatchewan has still not reported how many people have died in 2020, like in general. Okay, it is a disaster. And so the only province with any credible data is Quebec. And that's because of Quebec sovereignty, because the province has set itself up to be its own country. It has its own statistical agency and its own doctors running the statistical agency. And thanks to that, we have the INSPQ that, even though it's not super, there's problems with the INSPQ, but we have an actual data regime. No other province in Canada comes close. And some provinces are better than others. So Manitoba is better than others. Ontario is better than others, but by and large, it's very, very bad. And so, there's data that needs to be collected, like who's dying fully vaxxed, who's dying partially vaxxed, who's dying unvaxxed. And then there's data that I'm not convinced needs to be told to the public, like who's dying with a comorbidity. That's interesting data to collect for scientists. I don't know if the average person needs to hear, like the way the government of Alberta announces, this person had 5 comorbidities, this person had 2 comorbidities. It's just like, shut up. Like all you're telling people is that, you're safe if you don't have any comorbidities, which is just so ableist and horrible. And so, some of the numbers that I find the most useful are these numbers of these cases per 100,000 people. But without better data literacy and without better comparisons all across Canada, sometimes it just turns into like not that much of an interesting debate because of just, you can compare provinces, but it's very, very difficult because the provinces have such different data regimes. I will continue. And someone is unmuted. And if you're listening to a radio or a television or a call, that is you. Okay. Next question. Do I see the media spurring the public towards agreement with civil liberty infringements, the healthcare tax in Quebec, extend that to the logic of people who smokes and so on? Yeah. So one of the things that I think is so fascinating about this in Canada is the media has systematically shut out critique from the left wing, and critique from the right wing gets covered in these anti-vax movements or whatever, and they get a ton of coverage. The coverage isn't like to give them credibility, but it does actually help them. So it's a little bit complicated, but there is no critical coverage for those of us who are like, whoa, this is a disaster. What are you doing? And because of that, there also is a massive lack of coverage of our infringements on civil liberties. And so this past weekend, the federal government passed a law making it very illegal to threaten healthcare workers. Very illegal, right? It was illegal last week, but now it's really, really illegal. And I believe the maximum sentence is something unbelievable, like 10 years in prison. Okay. This is an attack on civil liberties. This is an attack on average people. This is an attack on people who find themselves in crisis in healthcare settings and who become violent. And we know that that is the biggest threat. That's the biggest physical threat to nurses and to personal care workers. Also, just moving patients is the biggest physical threat to nurses and personal care workers. As if any hospital management's taking that seriously, as if any government is taking that seriously. But they're going to make it more illegal for you to, threaten doctors or whatever, as if this wasn't already illegal. We have a serious problem with how we've been talking about the civil liberties infringements. And it's interesting to see the difference between Canada and European countries. I did a talk with someone from Germany earlier on in the pandemic, and he was shocked to find out that there's just no mainstream voice that's not the fringe right wing saying, whoa, 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 what does this look like for our civil liberties? Or what does this look like for our access to healthcare? And so Quebec is such a huge problem in this health tax, because the tax is a stunt. It's functionally probably impossible to implement because, it's too late. It's too close to tax season. We have an election standing between us and next tax season. But it's opened this discussion to separate out the anti-vaxxers to now say, oh, and they also should pay for their coverage if they're in the ICU. Or today, what was floated, if someone comes in and is in a high level of fragility, so if they have a comorbidity or they're anti-vaxxed or they're unvaccinated, they might have their surgeries put off further than someone who's not. Like, it's just created this incredible division that that was obvious, like could be anticipated. And I think a lot of people did anticipate that this was where it was going to head, but without actually having a credible and national voice to defend civil liberties in a way that also upholds the need for us to give up some civil liberties during this really different and extraordinary time. And so, yeah, it's a huge problem. I think journalists are ill-equipped to write about this in a significant way, in an important way that actually kind of unties a lot of these issues. And the reason I think that is because, no journalist talks to me. I've done so few interviews over the last 2 years. It's really shocking. It's been fewer than 20 interviews. But I do go on CBC TV once in a while to talk about whatever they throw at us. Literally, like from, I think I talked about awards shows once, and I was like, I know nothing about awards shows. I'm an expert in other things, but yeah, sure, whatever. The only way I can get on the public broadcaster. But this past week we talked about vaccines, and I had so many people saying, "Oh my God, I haven't heard your perspective on TV. Like, where is it?" And it's the reality is we are systemically shut out of media, even if journalists themselves are like, I don't get it. Like, you really, like, yeah, we need your voice. Like, what's going on? This doesn't make any sense. And it's like, I want to throttle you and throttle the system. But yeah, that's a huge problem. And I think it's also going to get worse because Omicron was such a different kind of experience where everybody got COVID. It felt like half of my friends got COVID in a matter of weeks. And I don't know if you've had the same experience, but the way that we talk about a virus when everybody gets it was just totally inadequate. Like, nowhere were we talking about massive staff shortages or of any sector until it happened. And then all of a sudden it was like, whoa, what the heck? This is a surprise. It's like, this is not a surprise, of course. Like, it isn't always about death. Sometimes it's just about people being too sick to go to work, right? Which of course activists have been pushing on. But the connection between our personal liberties, our personal rights, and the way that governments govern is just, I think it's going to bite us in the behind very soon. And I see a comment here. In France, we are starting to divide people who are vaccinated and others who won't be able to go into public places. Yeah, that's what's happening at the moment. And of course, France does have this anti-vax left-wing approach that's quite strong. And that's tied into, other movements like the anti-5G movement and other things that we also should be very, very critical of, for sure. But that just, it's interesting. In Canada, it's like we're so boring, right? Like, no one has any opinions here. And one of the things that I've been talking about a lot lately is that governments have been very clever in capitalizing and owning optimism. And so optimism has become coded in Canada to be government rhetoric, or you agree with what the government's doing. And so if you express optimism right now, you'll often get people saying, whoa, like, are you saying you support this? Are you saying you know, it's like, no, I'm not saying that, actually. No, everything's really, really bad. Like, I'm very pessimistic. But because there's no optimism on the left, like, we don't have an expression of optimism that captures the very real problems that we're experiencing right now, but also giving people, like, not just total doom. I think that we've handed over optimism to power, and it's become coded as supporting power, which is very bad for the left, because we need optimism. We need a way to be optimistic about things, and to not say, I'm optimistic about things, and then not have that de facto mean, I think Justin Trudeau's doing a good job. And that's a line that I haven't seen us really navigate very, very, very well. So I don't see any more questions. I don't know, Tracy, what are you thinking? Do you want to maybe another last call or another round, or?
Yeah, I just wanted, I just wanted to give a shout out to Steve Dross, the president of QPE New Brunswick's with us. We also have folks from the Tenants Coalition, and I was hoping that when you started talking about apartment buildings, I thought that maybe some folks of the Tenants Coalition may want to jump in, but yeah, and others too. If you have a question, raise your hand or put it in the chat room.
Totally. Yeah.
Thanks for this great talk. My name's Addy. I'm one of the organizers with the Coalition for Tenants' Rights here in New Brunswick. We've been very active trying to fight for some reasonable protections here in our province. You may already know that tenants in New Brunswick have far fewer protections than tenants almost anywhere else in the country. It's possible for landlords to just not renew a lease agreement for absolutely no reason at the end of a lease agreement. There's no rent control, and intimidation and discrimination are commonplace. What most recently has happened is we've started hearing reports that even we're in level 3 in our fight, regardless of how effective this fight is against Omicron, landlords who are seeking to sell their properties to prospective buyers in this hyperinflated, extremely overheated real estate market, and unregulated real estate market here especially here in New Brunswick, where house prices have increased astronomically faster than anywhere else in the country, and rents have increased faster than anywhere else in the country. Landlords are requiring tenants to allow prospective buyers into their units, despite the fact that we're in this fight against Omicron, and tenants have been contacting us, telling us that this is putting their lives at risk. We sent in a note yesterday to the minister. Haven't heard back yet. But it really does seem like one rule for us and a whole other rule for the capitalists.
Yeah. No, it's, I mean, housing, like, this is the thing that is just so shocking, is the housing market in this country has, in the pandemic, like, what is it? Housing is like the biggest industry in Canada. Like, it's bigger than oil and gas by a lot. And then the financial industry is it's like, how are we even a real country that our biggest industry is literally where people live? Like, are we nuts? I mean, yes, like none of this makes any sense. But what I've been so like fascinated by, in a very like macabre way, I guess, is this total lack of attention on housing, and on apartment housing. Because we know people are getting sick in apartments. We know that that's happening. It's obvious that that's happening. I mean, just today, a friend of mine who's an activist for people with long COVID, and she's had COVID. She got COVID like very, very early. She works in the healthcare world. Her daughter just got COVID, and they haven't left their apartment in 6 weeks. She was pulled out of daycare to be very safe, and our surge in Quebec City was very, very bad. And she's saying to me, she's like, we don't know where my daughter got it. And we live in the same neighborhood, but I don't know exactly where she lives. And our neighborhood's very, very old houses. And so not many people live in apartments, but there are some big condo blocks. And I was like, do you live in one of the condo blocks? And she's like, yes. And I was like, and in my neighborhood, most of the people that live in those apartments, they're not low income. I mean, there are low income spaces, but most of it's older people. It's people who after like the age of 65 are like, I'm not shoveling snow again. Like the city's got too much snow, right? So you just move into a non-snow shoveling kind of situation. So everything from, I quote the chief medical officer for Hamilton, literally saying that young people are engaging in risky business, risky activities, and in the same sentence defined the risky activities as sharing bathrooms with their roommates, right? And it's just like, you are literally giving them COVID. You are giving them COVID. And we are not talking about it like this. And Omicron, like if Omicron is so much more virulent, which it is, but if it's so much more virulent, that means that it will gather in HVAC systems more, it will go in the hallways more, it will go underneath doors more, it will accumulate more, and it will affect people faster. And the only advice we were given was to sit and wait for it to come to us if we live in one of these settings. It is so very enraging. And thank you for making sure that we've underscored how enraging that is. Steve.
Excuse me. Yes, I want to give a big shout out to Tracy and everybody at the NB Media Co-op. You do a fantastic job trying to protect the citizens and raise issues. And Nora, an extremely interesting presentation. I'm glad I joined. A few of the things that you've mentioned that have been bothering me. I'm a social worker by trade. Was elected president last year of CUPE New Brunswick. Great organization. I love CUPE. I'm a little biased there.
You're a member of PROMS. You get my services for free. So thank you.
There you go. But anyway, no, just, very concerned about the fact of where is the left, and we have so few remaining voices out there that are prepared to speak out, on behalf of all citizens, not just corporate interests. So, the point you raised about, they're not keeping good stats and data. We've been fighting for that internally within social development for years. We have crisis in terms of recruitment, retention, servicing. It's that particular agency that manages long-term care, and that's a disaster. They've been trying to privatize that. So the data collection is definitely, deliberate and intentional, so they can't be held accountable. Yep. So anyway, no, a great presentation. I'm so glad I signed on. Again, Tracy, thanks for the shout out. And, it's long overdue that, the left begin to organize and start addressing some of these atrocities because, just in long-term care, there was reports come out today, and I'm very close to a lot of these presidents that manage or, try to support these workers in Graham and Ann, which is isolated. 22 out of 30 residents and 25 of the staff now have Omicron. Right. And it's heartbreaking, it's gut wrenching, and they can blame it on the workers. And, bottom line is people have, I think there's a billionaire born every 26 hours now since Omicron began, and I read a word today and I went, okay, that makes good sense to me. It's economic, not crisis, but it's so illegal anyway. Thank you so much. I'm not going to take any more of your time. We would like to continue to hear from you and keep up the great work.
Thank you for that. I mean, the sad thing about New Brunswick in particular is the only data that we have about worker deaths related to COVID are thanks to their unions, announcing their deaths. And that is the case in other parts of Canada, though not 100%. I mean, if it wasn't for last year's day of mourning, I wouldn't have had any of the worker deaths in New Brunswick that I've tracked. And I think that, unions have been operating in a logic that believes that there is good faith possible on side of management, right? Like that is at the fundamental reality of unions, is that we believe that we can sit down with the employer and hammer out an agreement because at the end of the day, there is enough good faith. And I think that this is such an important moment to show that there really isn't any good faith. That if an employer can say, oh, 5 Canada Post workers dead, well, we're still going to cut your pay. We're still going to force you to work longer hours. We're still going to force you to lift all that stuff and hurt your backs. And, it's no big deal, right? Newfoundland, Labrador, that did such a good job to keep this virus at bay. I heard that the Dominion workers, 700 of 1,400 are currently sick with Omicron. And I'm not sure if you saw the notice from their premier today, Then the airport in St. John's is rejecting all flights with more than 19 people on board because of a shortage of firefighters. Because if a flight lands and it's got more than 19 people on it, they don't have the personnel to evacuate it. Like, it's just, and then who does that affect? Well, that affects the tar sands, right? It's just like, it's completely ridiculous. And I think that those of us involved formally on the left have to really have hard conversations with what does it mean for modern labor negotiations if there literally is no good faith on the other side of the table. And governments and corporations alike have shown that that's where we're at. The next question, and actually, it's more of a comment. I want to read it because I think it's really important. So it says, it's so nice to hear the ableism aspect at the forefront. I'm immunocompromised, been isolated for almost 2 years. Most of the time, it seems like no one cares. And for sure, I've certainly heard from people that they have seen their friends say things related to people who are immunocompromised that have just broken their heart. That the last 2 years have been especially hard because they've seen their friends and people they love say things that directly targets their safety and security. And so I do think that for all of us who are intervening loud and clear to make sure that we are talking about ableism as clearly as possible, this is primarily the way that COVID is targeting people, and we cannot say that enough. The next comment: 25% of those in the ICU in New Brunswick are presumably boosted, which suggests they are overrepresented. Is this because they tend to be older and or disabled? And so, okay, there's a couple of things. Like, we have governments that have said that vaccination is how we will end this pandemic. And that's not true. Vaccination is how we can stop people from dying, stop a lot of people from dying, but not stopping everybody from dying. There will always be people who cannot get vaccinated for health reasons. And there will be people who will not get vaccinated because they're not being formally mandated, right? There's no government that has a formal vaccine mandate. And so we have to not kid ourselves too much that vaccines are your ticket out to safety. They are definitely for a lot of us, but they are not for everybody. And, Steve mentioned this, blaming staff. I am so surprised to still see people say, this staff person's unvaccinated, it's their fault, they're putting my loved one at risk. The reality is, if someone is unvaccinated, but they've had COVID, they have some level of immunity, right? There's a lot of people who are unvaccinated who did get COVID, so it's not exactly true. And sadly, people with Omicron are triple vaxxed, right? Like, Omicron is spreading like wildfire among people who are totally adequately vaccinated. And so, yes, there's an overrepresentation in the ICUs of people who are disabled. Because it's a virus that puts people who are disabled at higher risk. And you can see some of those statistics. If you're interested, Alberta has the clearest statistics on this. So if you are interested in another jurisdiction, you can check out Alberta's numbers to see what that looks like. But it's a reminder that, again, we cannot vaccinate people to safety. And as Suzanne mentioned, being isolated for almost 2 years, there's absolutely no reason why people who are immunocompromised should have isolated. There are ways that we can provide safety to communities to allow people to participate in community life in a safe way that government has just not at all provided the resources to do. One example of this is across Canada, we are seeing deaths go down in residential care as a proportion of overall deaths. And we're seeing older people in the same age category have deaths happen very, very high. And there was a journalist at the Toronto Star saying, oh, I wonder, and actually I saw a journalist at the Montreal Gazette, because they're looking at their provinces, but it's the exact same data, the exact same trends. And they're both saying, oh, I wonder if this means that these are older people who are unvaccinated. And it might be. I mean, there's probably some people who are unvaccinated in that. But the reality is that inside of long-term care, there are ways to keep people safe. They're inadequate. We need to make them better, whatever. But there is PPE. They are being given some level of safety. And we've been fighting for that from the start of the pandemic. Elderly people who are living on their own, what have they been given? Like, literally nothing. What have disabled people been given who live with rotating personal care workers, who have to purchase their own PPE, who have had their benefits clawed back because they're on provincial assistance? It's like it's so unacceptable. What have they been given? They were given $600, a one-time payment of $600. Like, what an insult. So again, vaccines are important. We all need to be vaccinated. I'm getting my booster this week. I'm very excited about that. But it is not going to end this pandemic. And we have to not see a connection between vaccine status necessarily and severe outcomes, because it's not that clean. So on the lack of optimism, how do you recommend combating pessimism given how bleak the news can be? Right. So I was saying this to someone yesterday. I mean, one of the benefits of having written this book is that I've read it so much that I'm just like totally like, nothing can depress me. Like we've already hit the floor in terms of how bad can get. I'm just like, great. Okay, I've seen it all. Oh, the provincial government wants to do eugenics. Okay, great. I've seen it all. Like, not a surprise. And so it's kind of cushioned me from like those kind of like ups and downs of the pandemic where you're like, oh, another wave. Oh my God. And be like, this is what we have to live through until it either mutates into something we can really live with, or until it vanishes, or until, I don't know. But there are some very good reasons to be optimistic. There's very, very good reasons to be pessimistic. There are very good reasons to be optimistic. I think that the thing that I am most optimistic about is it should not have taken this moment, but it has. A lot of people are radicalizing. A lot of people are realizing that everything that many of us have been saying over the last 20 years is true, that it does take solidarity, that it does take community-based organizing, and that our politicians literally care more about money than they care about us. And it means that in the aftermath of this, that broken left that we've had for the last 2 decades has to get unbroken really fast, because we're going to have an influx of people seeking unionization. We're going to have an influx of radicals in our unions wanting to do radical stuff that might cost fines, that might result in breaking the law. And we have to be like ready to welcome people to our social movements in a way that isn't like, welcome to the left. You're going to join in our first 6-hour meeting tonight, and it's visioning. Isn't visioning great, right? And it's like, no, it's not. Like, it's great for like 10 people, but it's not great for most people, right? So I'm really excited to see how movements grow after this moment that we're living in, but we have to get through it. And I'm also really, 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 really excited to see how people put into action the need to be together. I think that our in-person spaces are going to take a level of importance that none of us have like experienced in a long time because of social media. And I'm really excited for that, even if it's like totally elusive and we don't know when that moment's going to happen. That makes me really, really optimistic too. And I mean, I think, you know, Omicron is something to be a little bit optimistic about as well. That it's not like when I'm hearing my friends getting Omicron, I'm no longer like sure they're gonna die. Do you know what I mean? I'm like, okay, checking in on them, seeing if they're okay, seeing if they need anything. But it feels very different than when my friends would get Delta or when my friends got COVID originally. And even though it's spreading like wildfire and the government's failures have meant that people are, of course, still dying, it's a mutation that could have gone the other way. You know, it could have been worse. It could have murdered every 20-year-old that got it, right? Like that would have been not good. And so we are going in a direction that I find, on the balance of everything, more optimistic, which is not to say that I'm happy about any of this. I'm just happy that it's not worse. I don't know. That's like really pulling at like whatever kind of thread that I can pull on there to be optimistic. But yeah, so there you go. And some thank you. Okay, comment. I wanted to say this conversation is really interesting for a French person like me, because some of the elements of your talk are talking about the same. And that lots of differences as well. So yeah, I mean, the global story of how this pandemic is being experienced is going to be told someday. As someone that lives in French Canada, it is very interesting to see the difference between anxiety among Francophones and Anglophones. I don't know if it's the same in New Brunswick, but the Francophones here are like way less anxious. And so when I go home and everyone's like a ball of nerves, I'm like, oh, whoa, oh my God, oh my God, you haven't let your kids play in your yard? Oh my God, they totally can. Like don't. My kids went to a birthday party in June 2020 outside. And we were one of the few families that did not send our kids back to school. We were like, hell no, no way. And I was talking to a doctor who was like, yeah, I don't know what's wrong with English Canada. Like everyone's freaking out. Like, this is great. We're at a park. We're outside. This is safe. And I was like trying to like push that out to people, being like, you know what? Like we also live in this Anglo-Saxon world that is very nervous, and we need to be aware of that and resist it sometimes, because it's not always healthy. And so, yeah, the question, if vaccination is not going to end this pandemic, what will? Solidarity will end it. Investments into communities will end it. Paid sick days and allowing people time off work when they're sick and giving them food when they're isolating and helping them get through the worst of this with public services, that's what's going to end this. Because, you know, I know that a lot of lefties are like, we cannot learn to live with this. I couldn't live with what we had before. I will not learn to live with this. It's unjust. And that's a sentiment that I totally agree with. However, we do have to learn to live. We have to learn to live, right? We are living in a pandemic and we have to learn how to live within it. And I think that the answers that the left has always had are needed now more than ever. And if we have hospital capacities that can manage a surge of patients and can continue operations, then that's getting us closer to ending this pandemic. You know, if we can have paid sick days, if we can have people not going to work sick, if we can have people not working 4 jobs to try and cobble together their existence, and they're not going to spread COVID in 4 different job locations because they're just trying to survive, that will help to end the pandemic as well. There are countries that have very different outlooks on society and on community than ours that have done much better in managing the pandemic, and we need to look to them. But if we think that everybody being vaccinated will just make it go away, Omicron has been a huge wake-up call to that. I just did a recording of Sandy Nora that came out today, and if you've listened to it, if you will, you'll hear that Sandy, my co-host, she's in LA. She has COVID. She's triple vaxxed, and she's not left her apartment. And that's the reality. We will get it if we operate as if vaccines are going to be the only thing that stops it. So there you go. I hope that's optimistic. Maybe it's pessimistic because, God, there is no community anymore and Thatcher is right. But I tend to think that Thatcher is dead and that we can, not listen to her corpse anymore. And there's optimism everywhere, right? Like, look at Chile, right? The home base of neoliberalism, and look at Chile and the elections they just had. Just incredible. There are so many bright spots on the horizon that it's important to, raise our heads a bit and look around as we're also head down getting through this nightmare.
Well, thank you so much, Nora, for all your insights. I think you affirmed for many of us, what we're feeling, but also you added so many insights as well. So thank you so much. I'm seeing, lots of people nodding, and thank you. And I encourage everyone here to pick up Nora's book, follow her on Twitter, her website too. And just to quickly say that the next talk is on February 1st with Elizabeth Dubois on political bots. And if you know nothing about that, like so many of us do, I think it's an important topic. It's something that affects all of us. So So thank you, Nora. And we'll be following your work, and we look forward to working together.
Yeah, and I mean, you know what? I'm New Brunswick is on my list to get out to the minute that we can. I'm not just saying that. My coworker at the Canadian Association of Labor Media has got family out in your neck of the woods, and so she's been itching for us to do a mini conference there. So the second we can, we will be out there and we'll do a mini training conference. It's not very political, but we need skills as well. So I'll make sure that you all are aware of it when we're out there, and maybe we can have a party or something. I don't know.
For sure. The Media Co would love to co-host it. For sure. Okay. Well, good night, everybody.
Bye, everyone. Thank you.